Hi, everyone. Good afternoon. Thank you for joining us, or good afternoon if you're in a time zone where it is the afternoon. I'm Dr. Lauren Weinstock. I'm the training director of the clinical psychology internship program at Brown University. And it's my real pleasure on behalf of our planning committee to introduce and welcome you to our clinical psychology internship question and answer panel discussion, which has been generously funded by the Academy of Psychological and Clinical Science following their summit on clinical science in May of 2023. And our aims for today are to really answer questions, help demystify some of the process of the internship application and match experience. We are really excited that this will be a two-part series. Both recordings will be archived and made available to people at a future date. So please keep in mind that all of this information should be accessible to you in the future as needed as well. And with that, I'm going to pass it off to Riley Jupy, who is one of our graduate student committee members who will kick us off today. Thank you for joining us.
Hello, everyone. Okay. So to give you a sense of the overview of how this meeting will go, I'm going to just start off by giving you a very brief description of how we came to develop this internship panel. And then we'll just jump right into the question and answer about internship application, match, or interview and match processes. And so then we'll go into an audience Q&A in which you can generate questions that you want to ask the panel as we go along. And you can do so by typing your questions into the Q&A feature on the Zoom bar. And we'll field those as we go along and hopefully get to everyone's questions. And then finally, we have some slides at the end about advice. So to give you a sense about who's behind this Q&A, so you'll see me, Luciana here, we're the students working on this project, and then various internship directors that also were involved. And why this Q&A was developed, Lauren had already mentioned this, but there was a need for additional information and support pertaining to the internship process that really became apparent at the summit. And so our team was assembled to develop a virtual question answer panel to address some common questions and concerns that everyone has about the clinical psychology internship process. And so what we did was we designed a survey, and you may have taken this, asking graduate students, current interns, and faculty about the internship application, interview, and match processes. And so we asked everyone the following questions. What questions do you have about these things? There were open-ended response options. And what questions do you wish you would have known to ask for those of which were current interns? And finally, what advice would you give to people going through this process? So we distributed the survey pretty far and wide, and then we assessed the survey data for common themes to inform this question and answer, including points to address and panelists to select. And so here is where the data informing this Q&A came from. A total of 183 respondents. Majority were graduate students, but there was a solid number of faculty and current interns or residents, postdoctoral fellows, people who've already gone through the internship process. And as you can see, most of these people came from programs that were affiliated with the Academy of Psychological Clinical Science. And of those that were grad students or current interns, majority of them were still in graduate school, so had not yet gone through the internship process. And so we had like 183 respondents, but we had a bunch of questions that came from them. And you'll see majority came from our graduate student respondents pertaining to the application process of the internship deal. And so today our Q&A is going to focus kind of heavily on this application process of internship, whereas our follow-up Q&A, we hope to focus more on this interview and match processes. But just to give you an idea of some themes that came out, we did go through all survey responses and sort of to get a sense of what was most pertinent to ask during this panel. And with that, we will get started with the Q&A, which is asking the questions that came out of the data that we collected. And just so you know, you'll have access to these slides. And so it could be helpful to go through them because we've also added slides kind of giving a brief overview of the application, the interview, and the match process that can be helpful to review, as well as the questions that we'll ask here. But yeah, go ahead and enter in the Q&A if anything pops up for you while we're going through this.
Okay, so for the Q&A portion of the presentation, I will be moderating, and we have Dr. Tara Mehta from UIC, who will be joining us, Dr. Shirley Yen from Harvard Medical School, and Beth Israel, Deaconess Medical Center and Mass Mental Health. We have as well Dr. Suzanne Penna from Emory University, who leads the neuropsychology training program there. And our panelist who will be joining us midstream is Dr. Kelly Lowry, who's a pediatric psychologist who will speak to internship sites that are primarily child-focused. Unfortunately, she wasn't able to join us right at this moment, but she'll jump in when we get a chance to go. So with that said, I'm going to kick us off with some of the questions that emerged from the survey responses that we received last spring. And we really want this to be generated by those of you who are most interested in the content, which is why we're really relying on the survey. But we, as Riley mentioned, will also have an opportunity to take questions live as we go through the material today. So kicking us off, it's the time of year. Everyone who's applying right now is working on their applications. And those of you who aren't are probably observing your peers and classmates doing so. So we did think this would be a time to really address several of the application-related questions. And if there's time to move on to some of the others, we will as well. And I realize as well, we need to introduce Colleen Sloan to the panel. Colleen, I think if you could come on camera. Yep. You're there. Colleen is from VA Boston and the training consortium there. Thank you about that. Sorry for the technical glitch. So to kick us all off, one of the biggest questions is a little bit broad, but maybe helpful to kind of hone in on, is a question about how much time students should expect it should take them to apply and when they should start putting together their application materials. Would anyone like to kick us off with that?
I can jump in. So again, my name's Tara Mehta. I'm from the University of Illinois, Chicago, and I'm the training director here for the internship program. And I think often I think about the process taking several months, but not lots and lots of time over those. I think you can spread it out, thinking about essays that need to be written, when you'll reach out, at least 3 to 6 weeks ahead of time for letters of recommendation. Tracking hours tends to be, that happens over time. And so that tends to come in a little bit later when you start, once you've got all the hours you think you've got, you're entering those a little bit later in the application process, I think, before everything's due, usually November 1st. And so I usually recommend that students start thinking about those essays at least a couple of months beforehand, maybe even more, depending on sort of how you write. But so that's, I'll leave it there. But I just think it becomes a process over time rather than a one time or two time, I'm going to sit down and just get these things done. So if you can think about it that way, I think it can also be a little bit less overwhelming. And then lastly, I would recommend that you open the API application as soon as possible, so you really see how they are slicing and dicing hours, essays, different pieces of the application, because I think that can be really helpful as you're gathering materials.
I would just like to jump in and concur with that. And I think that there's such individual variability with how we work. I think about it almost like a grant process, a grant writing process where, well, sometimes you're going to need to think ahead because you want to identify who your letter writer is going to be. You don't want to pop that question in the last minute, right? So there's a lot of planning that can be helpful, planning and organization. And I think that will also bring you up peace of mind as well, as many applications are due November 1st. Not all programs have that early of a deadline, but that's probably when you should be thinking about, I want this complete. And also on the review side, I do notice when people make mistakes on their cover letters, like when they refer to us by a different name. That is not a good start. And I think you want to really have time to review all your materials, including the cover letters, and all of that. So I'd say if you can find it in you to sort of begin this process early and have someone double check your work, you're going to be in a better position.
The only thing I would add to it is just also know what other responsibilities you have coming up. Typically what ends up happening is the semester that you are applying for internship, you may also be doing your dissertation proposal, or, well, I guess you would have to have it completed, but like collecting data, or like in like just the midst of yuck. So if you know you've got a bad semester coming up in the fall, then you might want to back it up a little bit and start more in the summertime. But aside from that, yep, I agree with everybody.
And I'm going to add one last thing. Shirley, you talked about the cover letter. As many of you may or may not know, the API it's a single application for every single internship. And that's challenging because we are very different in terms of who you're applying to and where you're applying. The place you can individualize very clearly is the cover letter. That's the space that you want to take some time to really think through. How do I fit with this particular internship? How do I fit, and what are my skills that I want to gain from this particular internship? And so I think sometimes people think that cover letter is just sort of, oh, I just need a cover letter. And in this particular process, that is absolutely untrue. That cover letter, crafting that to fit, is the place you can really talk about the fit, which is how many of us also evaluate some of these applications.
And I would add as well that some programs might have very specific instructions for what they would like to see in the cover letter. I know at Brown we do. And so not only is it a place to tailor, but it's also a place to respond to whatever additional information may be requested of you at the time you submit your application, which may not be built into a form field on the API, but is something that the internship program might like to know as part of your application as a whole. I'd add one additional piece as well in terms of the timeline is that typically in August, before the applications are due, that's when the APIC website is being updated with the most up-to-date program information for the upcoming application cycle. So just keep in mind, it doesn't mean that you have to wait and postpone starting if you're ready to start your application earlier, but just keep in mind that some of the information may change as programs are finalizing their plans for the upcoming training year. So keep an eye on that APIC directory information and the program websites for kind of late breaking and updated changes so that when you are finalizing your application materials, they reflect the training opportunities that are going to be available for next year, not those that are available this current year.
I just want to reiterate that last point that Dr. Weinstock mentioned, particularly for VA sites. We're a federal agency, and oftentimes we're kind of waiting on other parts to align in order for our materials to be updated and public facing. And we also have to wait for OAA, which is the Office of Academic Affiliations, to tell us what the stipend is going to be. So that is often outdated and takes a little bit of time to get that to be current for the website. So just want to reiterate that point to keep checking. And it's not uncommon to reach out to training directors directly to ask for updated materials. I've certainly received those inquiries and I'm happy to do it because we rely on things like public affairs and things like that. So it's not always a training program, but other entities as well. So don't hesitate to reach out.
Okay. Any final notes on timelines or time commitments for the process before we move on? Okay. So this is a question that seems to come up a lot, and it is, how many applications should I aim to submit? Would anyone like to kick us off there?
I think APIC actually has guidance on this. So they essentially said sort of 15 was the cutoff. And more than that, you have reached a point of diminishing returns. And I think they have priced it accordingly based on the data. Obviously, some people have some restrictions on this, you know, whether it's geography or other things. But usually 15 is considered sort of the sweet spot.
Yeah, I was going to say that they run this data every year, and that number shifts. I didn't recall that it was 15 in my recollection, and maybe this was for a different year. It was around 12 or so. I think it depends because there's a fluctuating number of slots available, and so I do think that there is a point of diminishing returns, and a lot of it is also your ability to tolerate some risk, because this is a decision that is often driven by personal factors of where you want to live and often build roots. And so if you are geographically limited in some way, or just have even strong preferences, you're going to have fewer applications. And it might be okay or tolerable for you to wait another year, or think about or put yourself in as available for phase 2. So a lot of it is, again, your tolerance for risk.
I would note from a neuropsych perspective, there tend to be fewer neuropsych programs. So I do see people applying more on the sort of 15 side of things than on the 12 side of things. And I think that just sort of is more representative of the fewer slots that we have in neuropsych.
That's a really helpful addition, Suzanne. I think that having that neuropsych perspective is unique and important for those applicants. So thank you for sharing that. Any other thoughts about number?
I think the only thing I would say is similar to what Suzanne was mentioning about neuropsych. I'm going to jump in for Kelly right now, and as a personal child person, even though our internship has both tracks, is that child also similarly has fewer slots generally if you're looking for a child focused space. So I think those applications tend to be on the higher side as well.
Agreed.
That's very helpful. Thanks. So this next question I think is a really important one, and it fits very nicely with one of the questions that we have in the Q&A about matching research and clinical interests, and how to blend those things and choosing sites. And the larger question is, how do I determine which sites may be a good fit for me?
I can start on this one too. I think really typically the internship year is thought of as more of a clinical year. So even people who have a strong research focus, keep in mind that most internships really are clinical in nature. And, I know sometimes people are concerned, like, okay, what I'm interested in clinically is not what my research is. Like, I did my research because that's what my dissertation mentor did, and I needed to do that. That's fine. people know that. I think what people are looking for on an internship interview is, are you a scientist? Can you think like a scientist? Can you appropriately evaluate scientific information? Are you an educated consumer of science? And, and some people show that by their research, but it doesn't necessarily have to be what they want to do for the rest of their lives, or necessarily what an internship site may specialize in. I think mostly they just want to see how you think like a scholar. My 2 cents. I know that's true for me and what I look for in my applicants. Can you just talk intelligently about what it is that you're doing, even if it doesn't light a fire under you or you don't want to do it for the rest of your life?
I can jump in. I absolutely agree with that the internship year is a clinical year for, by and large. At our program, Massachusetts Mental Health Center, you can opt to do a research elective, which is maybe 3 or 4 hours per week, but really it's heavily focused on clinical work. And that's true for most internships. It's a clinical internship. For us, I think I'm not at all concerned about research interests and clinical interests not aligning, because as Suzanne mentioned, some of that might be based on what your mentor did, or the opportunities that you had available. What I'm interested in is in the cover letter, do you tell a story as to why it is that you want to train with us, and do we have the clinical populations that are going to be of interest to you? So it's about fit, and it's about what do you tell us? And if it doesn't seem to make sense on paper, you might want to try to weave that together in the cover letter of why this makes sense to you, that you want to train here.
So I'm going to jump in with what I love about this conversation is that something that I know Lauren and I and several of us have talked about over and over again, especially in the clinical science world, which is most internships are focused on clinical work. There are a few of us that have a more research focus or have integrated research in a different way, I think. And it's the cover letter where you can tell us that story. So UIC happens to be one of those spaces. And it's the cover letter where you can talk about that integrated story. So what Shirley said, I am still looking for, and I think, Lauren, several of us who have a little bit more research focused internships are still looking for an integrated narrative. Why does it make sense for you to bring these areas together, or how do they in some way fit together in your future goals? And in our case, in a letter, I want to see that. And I would like to see a little bit more of your research interests. And again, I'm going to emphasize the cover letter. This is the place where you can do that and sort of talk about how you fit with those different spaces, because fit is critical. And that fit and it can be different, by the way. So it can be that you're applying to a more research oriented and you're going to write a cover letter that really shows your narrative and fit in that space. You might have another internship, which is much more clinically oriented, and you may fit there in a slightly different way. So I think one of the things about these applications is to think flexibly about what your goals are and how you fit with each of the spaces you're applying, because that's going to be your best shot at getting interviews. We're not all completely consistent. That's a human being, folks. And so thinking about it that way is, what do I gain from internship site 1 and how do I fit there? And I might gain a slightly different set of skills at internship site 2, and that's going to be a slightly different fit there. And both of those are positive ways to go through your internship year.
I agree with everything that has been said. I would also just add, program informational materials and brochures are going to give you a sense of what the program's values are. I mean, we kind of all know what we're supposed to be doing on internship. It's a requirement. There are certain kind of, boxes to check. And there are different cultures across programs as well. And so I encourage people to be really thoughtful about a values-based match as opposed to like this program has a name or a reputation, and more like where is it going to really feel good for me, and I will know that I'm in the right place based on the kind of the advertisements that you're able to review in your review process. You will also get a better sense when you are on interview, and so at VA Boston, we always encourage people to actually pay attention to how they feel over the course of the interview day to try to get a sense of that, goodness of fit, et cetera. But to back up a little bit and talk about the application process, I think one thing to be really thoughtful about is your desire to work with a veteran population. So you are going to be working with veterans clinically in a VA. This is a unique population with unique health needs, and it is important to articulate what it is about your professional values and your goals as it relates to contributing to veteran health and veteran wellness. So that's always something that we really like to see. Again, going back to the cover letter, tell us why you want to be working with this population, and then more specifically how your research and clinical interests kind of match those of the program and what they offer.
I'll just chime in too. I agree with what everyone is saying. And I really like, Colleen, what you were saying about a values match. I think that that's a really important way to approach the process. I would also think use this opportunity to really reflect on what your goals are for internship. What is it that you want to learn and either do more of or do something differently? If it's, exposure to a new modality that you haven't had an opportunity to get exposure to in graduate school, that's great. Even if you haven't done it, if there's something that's really driving your interest in learning something, that's a great thing to point out. And if an internship site offers that training, that's a perfect way to express your interest in the training opportunities there. It could be a population, it could be a certain setting. We have a lot of partial hospital and intensive outpatient programs here at Brown, and I have a lot of residents who are here say to me, I've never worked in this kind of setting before, and I really enjoy it, and I've learned a lot doing it. And so thinking now about what types of settings or populations, or again, modalities, you might like exposure to, that'll really help you find programs that might provide those training opportunities for you. And I think those would also be places where you could identify that fit that a lot of people talk about, whether it is something that you're really passionate about and you've done a lot of in graduate school and you want to keep building on, or if it's something new that you haven't had, but that makes sense within the context of your larger professional goals. So those would be some additional things I would add.
And I wanted to add one maybe last thing on this, which is, you're thinking about as an applicant fit with a program. As program directors, as we review applications, we're also thinking about our fit for you. So do we have, and I think this was mentioned earlier, and I'd just like to say it again, do we have the experiences and opportunities available to encourage and support your goals? So you may be everything on paper might look fabulous, and what you're looking for is exactly, what you want, and you've laid it all out. If I don't have those experiences to give you, then you may not get an interview with us, not because you're not a fabulous applicant, but because I don't have a fit for you. And so I think that's something I hear over and over again from graduate students who reach out to me. It's like, why didn't I get this? And sometimes it's because I didn't have what you needed. And so I just want to make sure that that's getting out there as well, and that you're sort of thinking about that as well, and sort of hear what sort of from our perspective, what we're looking for in that way as well, and what we consider when we review applications.
Any other thoughts on this question before we move on? Great. And I do want to acknowledge there's some great questions in the Q&A that I think will complement some of the questions we have for a little bit further down in the panel today. So if we haven't answered it, know that we see them and we'll incorporate them. during our time together today. So for our next question, this has still kind of has to do with the planning ahead. So far we've talked about like how much time someone could anticipate, when they should be looking at materials, thinking about their application. We've talked about identification of sites that might be a good fit. This one's a little bit more nuts and bolts, I would say, in terms of planning. As you know, not necessarily the month before applications are due as we are right now, but over time, questions about, and we touched on this already a bit, but how much experience do I need in certain settings to be competitive at certain types of sites? And then following from, what will we pause there and just get a little bit more thoughts about that? And then I'll follow up with the next question.
I can start. I do think that informational materials sometimes will provide information about what makes a particular applicant competitive, but it really varies. And so I'm speaking from a VA perspective. Some VA internships really, I don't think require, but really appreciate having prior VA experience, in part so that you have a sense of what the patient population looks like, and because we have an unbelievable kind of administrative component to the work that we do, and the onboarding and the kind of getting up and running tends to be a little bit more complicated and kind of intense for a lot of folks. And it's much, much easier if you've had VA experience as a prac experience kind of in the past. Having said that, it is not a requirement. And again, if you're able to demonstrate your fitness kind of beyond being more competitive, that's really compelling as well. So for someone who has VA experience, but isn't really talking about wanting to work with veterans or kind of talking about other things that don't really align with what we can offer in a program, that person would actually be less competitive than somebody who did not have prior VA experience, but really makes a compelling kind of story or argument as to why they would be a good fit and why they are, eager and excited to apply to a program and to possibly work with them.
I would agree with that. I am not currently working at a VA, but I worked at the VA for 7 years and was part of their internship process. And it was true. It was never you had to have prior VA experience. And a lot of people even said, like, I hope I'm still competitive because I don't have this, but I want it. And yes, that automatically is like a point in your favor because you show interest in this population. In terms of experiences, again, I'm kind of going to put on my neuropsych hat. You need neuropsych experience if you're going to apply to a primarily neuropsychology internship, one that offers sort of a major experience. So, there's your major experience, there's your exposure. And so if it's going to be half or more, you need some solid neuropsych experience. I would say at least a year in practicum. Obviously, not all sites have neuropsych tracks, so coursework is kind of, it's iffy. Some people offer it, some people don't. I would say if you come from a program that does not have a neuropsych track, which many, many people do, I would look for other experiences as in going to conferences. So INS, International Neuropsych Society, National Association of Neuropsychology, so NAN, doing some of the online trainings, listening to the podcasts that we have, so Navigating Neuropsychology, some of the No Neuropsych lectures. There's a lot of online free tools that you can access to get experience in addition to, I would say, at least one practicum site that's neuropsych. I think you would have to have that to be minimally competitive.
Weigh in next. I agree with all the panelists so far. And we're not a VA site. We at the Massachusetts Mental Health Center, we are community mental health that's funded by the state, which means that all of our clients have either severe mental illness. They have severe mental illness and are of limited economic means. So again, knowing who is being served is very, very important. And, we wouldn't necessarily exclude someone without any experience in severe mental illness. But that's going to be a disadvantage. I'm going to be perfectly honest, because it is a very, very distinct, difficult population for which a lot of the manualized based interventions are just not going to work. I'll just state that outright, because that's not the population that is being researched, to be perfectly honest. So I do think that we look for that experience, or at least a really, really good explanation of why you don't have that. In terms of someone, I think, Lauren, your first question was about, how much experience. We don't have a minimum number of hours per se, but we do look at it. So I think it can be, it's something good to pay attention to. Do the internship programs I'm looking for, do they have a minimum number of practicum hours that I need to have?
Yeah, I would just add that I think it goes back for sort of for us and for many places potentially back to the values, right? So if you can create a coherent argument, for example, for us, we have a very, UIC, we have a very diverse population who we work with, and it's also under-resourced, and it tends to be, and we have a variety of different types of experiences. And we often get applications talking about, I don't have as many, the diversity of people I've worked with because I've come from a particular space doesn't match what you all have. That is okay. But we are looking for a level of, you want more experience in that area. Give me an argument why you want more experience in that area. Tell me why what we have is a good fit for what you want. Whether you've done it in the past or not, why do you want this type of experience? Why is this important for you and your career goals? So it goes back to that fit piece. I think around there, and really thinking about how those things mesh together for what you're looking for.
So I'll just take a brief moment to welcome Dr. Kelly Lowry to the panel. We did a brief introduction for you in your absence at the beginning and noted you would be arriving midstream, but I wanted to kind of loop you into the question we're at right now, because I think it could be really relevant for folks who are child focused. So the question was, how much experience do I need in certain settings to be competitive for those types of sites? So we've spoken a little bit about neuropsych specifically. We've heard about VA. We've heard from kind of the community mental health perspective, the academic medical center perspective. So, from a child site perspective, I'm wondering, not to put you on the spot right as you're joining us, but I think it could be a really nice place for you to jump in if you have some thoughts.
How's my audio? Can you all hear me okay? Okay. Well, I am happy to be put on the spot. And before I even kind of address the question, just want to again thank all of the rest of my colleagues on the panel and the organizers for inviting me to be able to be a part of this today. One of my favorite things is to be able to talk with prospective applicants and students as they're considering this really exciting and sometimes also pretty stressful next step of their career. So I'm happy to answer questions today. I'm also happy if anyone wants to send me additional questions offline that are kind of direct and specific to the site. I realize my name updated pretty minimally, so I'll also indicate that I use she, her pronouns, and I'm the training director, as you might have heard, at Lurie Children's here in Chicago. So the question about how much experience coming in is a really good one. And I would say it is a hard answer because on the one hand, it varies, and on the other hand, it might not matter very much. So things where I think it matters to us, at least, and I can speak only for our own program, is we are a program that exists within a children's hospital that is 100% child adolescent with potentially a little bit of young adult based on experience, but we're really a primarily child and adolescent program. So it would be unusual for us to be a great fit for an applicant who has never had child experience of some sort during their graduate training. But we absolutely, and quite frequently, if not most of the time, have great fits with applicants who have had experiences across a developmental range in their graduate training. So if you are in a space where you've also had adult training, that could be really complementary to the work we do. One of my favorite things to tell people becoming future child psychologists is that the great challenge of our field is you're going to still spend a lot of time with adults because kids live in families and they're caregivers, and we spend a lot of time with them. The other place where I hear this question a lot, because we are a medical center and we have a fair amount of pediatric opportunities, is, am I a good fit if I haven't had those medical context and experiences before? And that to me doesn't matter nearly as much at all. I highly recognize that in some ways there are limitations to the types of clinical experiences that you can access in your graduate program based on maybe the location of that program or the opportunities in the area or the region or the space. And so what matters to me much more is where you want your career to go and how we can help to build and grow that further. Probably, if it hasn't already come up, has come up the idea that internships should build on things that you already know that you like, and then offer the opportunity to fill in those gaps of areas and spaces where you've had less opportunity or experiences. And for many of our interns, sometimes this idea of medical spaces is a really big one. The other area where I think we have a lot to offer is that we're really fortunate to be housed in Chicago, which has an exceptional diversity to our patients, our families, our population, our colleagues, all of us. And again, there are so many ways that we want to consider thoughtfully identity and diversity. But Chicago and our training program is a space that has a lot to offer of range in those areas as well. And we would never negatively evaluate a future potential intern if they've had less opportunity in those spaces either, especially if it's just not something that was accessible during your graduate training.
Thanks so much. That's a really helpful response, and makes me want to visit Chicago. Haven't been in a while. So for this next question, I think this is a big question and gets a lot of attention, I think, in the chatter around internship. And unfortunately, Dr. Penna had to step away for a few moments, but hopefully she can join us on the tail end of this question. But lots of questions about how many hours are needed to be competitive and how much emphasis is placed on hours. And so I know a lot of people have a lot to say about this, so I'll step back and let people chime in. And again, it may be different. We've got child and neuropsych. We have different settings represented. So it'll be really interesting to hear how our panelists respond.
I could start. I do think that most programs are going, if they do have specific requirements, they're going to outline that in their program materials. And so you should be kind of well aware of what that is and ensure that you have what the requirements are based on the program materials. In terms of like greater number of hours versus quality of hours, I will say certainly for our site at VA Boston, we're more interested in the quality of the experiences that you've had more than the quantity of. We have a minimum requirement as well, but we're really looking for experiences that would actually set you up well to be able to thrive in this environment. So, somebody came and was applying for us, but they had mostly child experiences and then a little bit of experience with the university kind of counseling center. That person would be less competitive than somebody who maybe worked in community health or had worked with veterans, even in a non-VA setting, or worked with kind of complex mental health presentations that would kind of set them up or give them that background that would set them up for success within our training program.
I would also echo that. For us, I think we take more qualitative view. As I mentioned earlier, we don't necessarily have a minimum number of hours requirement, but we do look at it, right? So if it looks very low for the number of years that you've been in graduate school, that might raise some questions. The reason why we don't have a set number is sometimes we get folks that had a prior degree or prior life, that, you know, their hours may not be necessarily not registered, but it's very, very valuable life experience. And so we want to look at that. And so again, it's, you know, what specific experiences have you had that resonates more so than the specific number of hours? And if your hours are too low, it will raise questions.
I would agree with Shirley. I think we look at sort of the ratio. So again, neuropsych hat here. You should have more assessment than therapy hours, but you should not have 0 therapy hours. So it's sort of, again, we don't have a minimum. We don't even look. I'll be honest, I don't even look at that number. There's other numbers I look at, but number of hours is not one of them. What I'm looking at is, again, variety of places you've been, types of patient populations you've seen. Does it fit with what you're looking for? Does it fit with what we offer? That's really what I'm looking at. And, you know, do you have enough experience, particularly in neuropsychology, that you're not going to die on this internship? You know, that you're not going to just be completely overwhelmed.
And I would agree, we also don't have a minimum. And in the same way, as we're looking for that quality, what have you done? Does it fit with what the opportunities we have and the gaps you want to fill? And I'm hoping what you're hearing is a little bit of, there's not a magic number, because I think that's what we get all the time, is that what is the magic number? And there isn't one. It's really about what your experiences are, who you've worked with, sort of, how does it fit into your narrative, into your story of what you're doing and what you want to be doing and the holes you want to fill in terms of your experiences as you've moved through graduate school. And I know that's a potentially unsatisfactory answer because it would be nice if there were a magic number. I wish I could give it to you. But again, I'm hoping what you're hearing from, I think, all of us is this idea of how can we further and support your goals, and how do you fit well, and can we provide the experiences that you want as you move forward? So I can, you know, all of us are saying similar things about that particular question.
And I would just add, at our site at Brown, we do have a minimum, and that is coming from a place of wanting to balance exposure. And that's something we can quantify through your hours, but also we really do emphasize all of the things that everyone else has said in terms of the quality of the experiences, in terms of setting you up for success at a place like ours with the opportunities and the different settings and populations that we're serving. So that is the emphasis. With that in mind, once you've met the threshold, in my experience, and I want to speak for other training programs that have these minimums, but it's more is not necessarily better in terms of number of hours. We want to have some threshold to open the door for review of the larger, experiences that you've had. And so it's really, if you have 100 more or 200 more or 1,000 more, at that point, it's not really going to tip the scales any way or the other. It's really about just sort of that entry point for us in terms of feeling like that somebody coming to our program would be ready for the rigors of the training that we offer. So even with the threshold, some of the sites here are represented don't have a minimum. We do, but that's really the context in which we're presenting our minimum. And and we also, just as a sidebar too, in terms of like little ticky nuts and bolts details, it's good to read the fine print and the application materials for the different programs, because some sites will also consider not just the hours you've accrued at the time of the application, but also the hours you anticipate for the coming year. And there is a place on the API to indicate that. So, just be mindful as you're reading through the materials. If it appears that you don't meet that minimum threshold for a certain site, it might be that you do if you factor in the clinical work that you're doing at the time you're applying.
And one more point that just comes to mind that I'd like to not forget is that many of you who are applying now and who potentially will apply in the next year or so, did graduate school through a really unprecedented time of a pandemic.
Mhm.
And we're aware of that. We're aware of the fact that there are probably some of you out there who weren't able to do practicum hours because you were in a school setting and school shut down. There was nothing for you to do. That, there were places and spaces where you had to engage in that clinical service and that clinical work in very different ways than any of us expected or were used to doing. And so if you use, I'm going to go back to the cover letter or in the essays or somewhere to sort of talk a little bit about that, that can also be helpful. And to let us know how you're thinking about that and maybe what you missed and what you're looking to gain. I think that's another thing, because although in our larger universe, it seems that that time is afar away, we recognize that it's not, especially in terms of the ongoing education.
My colleagues have said it all. I have nothing to add other than to agree. It is quality over quantity. We have a minimum recommended threshold for the same reasons already discussed. And again, significantly more hours above that does not substantially increase or the evaluation of an applicant's materials, because we want you to come because we have something still to offer to you. And we want you to be able to learn and grow with us in ways that are complementary, but also potentially unique to what you've already had. So.
Okay, so moving along again, some of these are a little bit more nuts and bolts, but there's a question about integrated reports. And I think maybe several of our panelists may have something to say about this, but I know in particular for neuropsych, this might be especially a relevant question. So, so the question is, what's an integrated report? And what are sites looking for in sample assessment reports?
All right, I'll start. So an integrated report, what we are looking for is a report that has a clinical interview, tests, administration scored, and a comprehensive summary and integration of all of those sorts of data in it, as well as recommendations. That would be, and that goes for a psychological assessment report or a neuropsychological assessment report. So the clinical interview plus the tests with an integrated summary of all of that information. I will say this is the number that I look at. I know other sites may look at other things, but I know that my site in particular is very clinical heavy. And if you do not have enough experience, if you are coming in with only like 20 adult reports, you're really going to struggle on this internship. Now, if you come in with 100 integrated reports, I'm wondering if you were ever in class. So, I think it does vary, but a lot of times people do a lot of testing as part of their research, but don't do that full integration. And that's really, and having test experience is fantastic. It is necessary. It is important, but that integrated report is that extra step. And so again, I would want that number to be probably above 20. Again, it's not a hard and fast rule for us, but I just know for my site, people who have more experience writing will have an easier time and, quite frankly, a richer internship experience because they can go into more detail. They're sort of starting out of the gate at a minimum level.
So I'm speaking from the perspective of our program. We have 18 slots and 12 different rotations, one of which is neuropsych. Totally agree that our folks on neuropsych who are reviewing applications are looking for a good solid number. I don't know, what the requirement it is, but likely, the more the better. And to speak to what Suzanne just mentioned, if you have very little experience there and that's going to be a major component of your training, that's a really steep learning curve and is actually going to degrade your experience. So just want folks to be considerate of that. And then across our other rotations, the degree to which you might be writing integrated reports and engaging in that kind of assessment varies. There are some where assessment is actually a minimal, maybe even absent component of training, and other rotations where it is a larger part or a significant part. So again, pay attention to descriptions of the rotations and the informational materials, and to try to get a sense of how relevant that piece is on your end.
At Mehta, we also do have a neuropsychology track, and we ask for an integrated report, a de-identified report, as a requirement of our application materials, which is most relevant for the neuropsychology rotation. And for the other rotations, we ask for a treatment conceptualization report.
Shirley, could you talk a little bit more about what you would expect to see in a treatment conceptualization report?
Yeah, that's very interesting. I think it's about, so that's a very good question. One thing that we look for is writing, because there will be a good amount of writing, of notes, or actually your ability to communicate. So we, at our internship site, we are sort of agnostic in terms of treatment modality or the perspectives. So we have supervisors who are psychodynamic as well as cognitive behavioral and third wave CBT. So we welcome, I think, just really well thought out, well communicated case reports, and I think extra credit is given for the complexity of the client, because our that reflects the population that we serve. So I think that would be much more favorable to someone, for example, with just anxiety and a CBT case conceptualization, as an example.
This, I think, I don't know if it's unusual or not, but I will say we at our site at Emory never ask for integrated reports or an example of them. Mostly because I don't know who wrote it. Was it you or was it your supervisor? So what we will almost always do is during the interview, ask you about a particular patient that you saw or case presentation that you saw that was interesting, why it was interesting, what you found, because that shows me your thinking. But I know people whose, their supervisor ended up rewriting the entire thing. So I don't know whose words this is. So we don't bother. We don't ask. And I know we might be an outlier in that.
Suzanne, that thought never even really popped into my mind. Thank you for putting that thought in my head.
No problem. Happy to help.
So I will say we don't ask for integrated reports either. We do have a neuropsych rotation where folks jump into that who have done very little to very lot, and they do a really nice job over there of matching that. What I do want to comment on, though, is I think something that Shirley said earlier, which is well written. So I'm jumping a little bit to a different space, but throughout the application, we are often looking for well-written essays, cover letters, because a lot of what you do, right, in a clinical internship in psychology is write, right? Whether it's a report, whether it's clinical notes, whether it's a research paper, whether it's a proposal, you're writing. And so one of the things that I'm looking for in terms of that underlying maybe value, I'm not sure, can one write well? What's your ability to communicate in writing? And to that end, I would encourage everyone to have other people look at your application, look at your essays, get feedback from colleagues, from peers, from supervisors, from mentors as much as possible. Because I think that can really strengthen an application along those lines, which is sort of that overarching piece that we often look for, which can someone write well?
I'll jump on and address kind of what Tara just brought up first, which was, oh my goodness, please have somebody else take a look at your materials. I would never knock an applicant because if they have a typo here or there. We're all human. We all have typos. But if it is riddled with typos, if there are major concerns, if there was something fundamental in your cover letter that really was maybe belonged in a different program's cover letter that was kind of critical and major to a difference in my program versus a different program, those unfortunately stick out. And it can be competitive, and applications are universally pretty strong. So there is significant benefit to everyone, even if you yourself have read it 14 times, to have a fresh set of eyes, take a look at it before it goes out and give you some, whether that's overarching feedback or kind of specific feedback. That's a really good point. And it's also sometimes an easy fix, right? To just prepare your materials far enough in advance that someone can take an extra look. Specific to integrated reports, we are a site that does not have a neuropsych track. So we do not have a minimum number of them. But I would also say, as a site where that is a smaller intensity rotation for us, I would still want an applicant to have had kind of a minimal opportunity to be able to engage in building that skill during their graduate training. Also, very much understand that COVID probably is still a factor very much to current applicants. And we know that hit particularly hard when it came to testing and assessment. So we're absolutely understanding of that. But since it is a smaller intensity rotation, we're hoping that the individuals who would match with us have some minimal degree of experience in that area, and also recognize we're not going to have an entire year to fully develop that skill set that I think is such, just a unique skill that psychologists, particularly in medical settings, as opposed to other behavioral health disciplines hold, that is something that we would be able to build on and maintain, but not necessarily build from the ground up, or be able to build to the level of competency of then being a neuropsychologist in the future.
Wonderful, thanks. And so while we're still on this topic, we had a question in the Q&A, again, kind of more nuts and bolts. But could people speak to some, as we've heard from the responses, some people have more integrated reports and not, or don't have them as included as part of the application. But for those who are tracking the integrated reports on their side, can you speak to the variation of tests that are needed to count for integrated? For example, cognitive and academic achievement, or anything you could say about specifically what would be included in that?
Again, I think it depends on your referral question. If you had a straight psychiatric, like differential diagnosis, I don't see any strong reason to have cognitive testing in there. I think, if it's a neuropsych evaluation of a person with possible dementia, you don't need academic achievement in there. So I think it depends entirely on the referral question. And really, again, what we mean by integrated is, are you integrating multiple sources of information? Are you integrating medical records with your clinical interview, with your testing, and coming up with a summary? And are you integrating all of that data? The data itself, the specifics don't matter as much as just the process of integrating multiple different collateral information.
That's super helpful. Thank you. So we have another question in the Q&A. And this again relates to the application process. So we've been talking a lot about what goes into the application. But there's a question about, once the application is submitted and sites are doing their initial review of applicants, what are some, kind of behind the curtain thoughts you could share with the group about how those applications are reviewed? What materials do you weigh in terms of decisions about who might be invited for an interview? Are there any thoughts you could share?
I can jump in to start. So I would say that we start with the CV and the cover letter, because those are really good summaries of, and it's, when and there are other internship sites that get many more applications than we do. We get close to 200. And so we need something to start out with. And so usually it's the CV, which is a nice summary, and a cover letter, which is telling me how you fit, what you want, what your holes are, how you want to think about it. And so I would say those are the things that are really that first read through, are those. And then we move on to the essays and some of the experiences and things like that. So just as a piece of information, I know I'm going back to those cover letters again, and then the CVs.
100% agree. Those are I think the two most important parts of the application. And I would say CV and then cover letter, in that order. But I do think that the cover letter is a really excellent way to highlight stuff that might be buried in your CV. CVs are long and there's a lot of information in there. And it's just like, what are you most proud of? What did you do that separates you from some of your colleagues? What makes you exceptional? Throw that in your cover letter. Like, that's the way to sort of, use the cover letter as a highlighter of your CV. That's how I sort of think about it. The other thing I will add, and again, this is a me personal thing, I love to read essay 1. I love that essay. And because it gives me a sense of who this person is. And sometimes I know, particularly in neuropsych, there is the tendency to just repeat what is in your CV on essay 1. I would encourage you maybe not to do that so much. And again, like I said, this might be more neuropsyche because people are like, no, we're the sciencey people, but I just kind of want to know what makes you tick. Can we hang out together? Because a lot of people have done really, really impressive things. And again, are you going to fit with who we are and what we have to offer?
I want to weigh in and concur with that, because I think there's the objective assessment and the subjective assessment. I think the CV, for me, objectively, is the most important part, because that's the part that actually doesn't vary from application to application. Yes, the cover letter is so important, but I also know that people can sort of say what they need to say to get that interview. The CV, this is just what you've done. This is how you've chosen to spend your time. And so I do think that's very important. And for me, the first thing I read is essay 1, because I want to get a sense of who you are as a person. And that's how I'm going to remember who you are. It's the details in essay 1. And I agree with Suzanne 100%. I hope to not see a reiteration of everything that's just in your CV. Tell me something about yourself. Because we get lots and lots of applications. It helps to give me something to hold on to. The one thing that hasn't been mentioned yet is the letters. We do read the letters pretty carefully, right? Because that's the other thing that is universal, going to all the sites.
Absolutely. Yep.
And I do really read through, not only for the information that's there, but for the information that's not there.
Yeah, I agree. Again, I agree. I read the whole thing. There's good stuff in different sections. We've worked really hard to try and make sure that we are as objective as possible during this process, because we know all kinds of subjective bias can come into play when it comes to looking at applications and also the interview period. So we have an evaluation rubric that we've created over time to be reflective of factors that we feel like are important foundational experiences to do well at our program, and then also to reduce bias in our evaluation of prospective applicants. Essay 1 is such a gift. It's often the why, right? The CVs are certainly important. The cover letter important for all the reasons that we've said. Just essay 1 kind of brings humanity to the words and the paper and the experiences and the lists of patient numbers and hours and all this other kind of thing. Whether someone kind of makes it to the next round or not is normally twofold, right? It's that you've had those foundational experiences that we know typically are indicative of being able to be successful in an internship like ours, and probably most important, the amorphous fit, which is just so hard to define, but for us really comes down to this idea, and I think is true at most every place. Are we in a position to build upon, interests and experiences that you've already had, and then be also able to fill in the gaps and strengthen experiences that you've yet to have to help you then take that next step after us into the career pathway that you are really trying to get to? If you've done everything that we have to offer, believe it or not, that might actually not be a very competitive applicant for us, because what do we have left to give you? But if we're really going to build on something and then help you kind of take those last steps and stages towards whether that's postdoc or the career ahead, we're here to train, so we want to be able to kind of help you build and continue to grow. So when it comes to the cover letter, when it comes to the CV, those are the things that we're looking for. And then similarly, the letters are important. And breadth of experience in a way that aligns with what we may realize is it was or wasn't an opportunity where you previously trained are things that we look to as well.
I agree with everything that's been said, and it's making me, when we're talking about reference letters, I do want to encourage folks to avoid misrepresenting your experiences. I know that I can appreciate kind of the urge to, want to really sell yourself, and sometimes that can lead to embellishing a bit. And I encourage people to avoid doing that and to be very honest and transparent about your experiences, because one major red flag is if somebody has described their training experiences in one way and then you learn in a reference letter that it was actually quite different from that. That's not a great sign for application reviewers. So just be honest and identify areas for growth. I know at our site, we really value humility and somebody identifying, where we expect you to have areas to grow because you're coming to internship, and we are excited to train you in those areas if they're a match. So keeping that in mind. One essay that has not been mentioned yet is the diversity essay. And so different programs have kind of attend to DEI related issues in different ways, whether it be our patient population or the values of our program or, didactic components, et cetera. So we look at that pretty closely as well to try to get a sense of, somebody's knowledge around terms or the way that they conceptualize maybe a case of a diverse patient, things of that nature. So you can likely tell the degree to which that's of value for a training program. And if it is, and is strongly emphasized within program materials, I definitely encourage you to be very thoughtful and get some feedback about the diversity essay as well.
Can I just also add one thing Colleen mentioned, which is a really great point about not overstating things, because we also see that sometimes in publications and what is called a peer reviewed or not peer reviewed, or they're just discrepancies, between where it's stated in the application and the letter. And those things, they do come out as slightly, we think, is that a red flag? So it's just better to try to be as factual as you can be.
I was actually thinking very much along those lines as well, in the couple of different points. I think consistency across the application is really helpful, and utilizing the essays to highlight different areas. I think a couple of people, and I would absolutely agree, you don't want to see the same thing over and over and over again. And I'm going to list my CV and then I'm going to list it in the essay again. And then I'm going to talk about, if you can use those essays to highlight different spaces of who you are and what you bring and what you're looking for, as well as this ability to be who you are and be authentic. And I think that's true for the application. That's true for the interview. We are trainers, as was said, and I just want to emphasize, we're excited to train. We're excited to know who you are. So just sort of be that person and be that space in that space. And the last thing I will say, that we also read letters. We're also very conscious of the fact that people write letters very differently. And, a lot, the way folks write, we often get letter writers because of sort of the programs, we get people from similar types of programs across the country, and sometimes they're the same people across the country. And we recognize that, there are different words and embellishments and how people rate people are different, that letters are also subjective. And so it's really more about consistency per se than it is sometimes whether, is there a red flag somewhere, what's said and not said versus how they're writing, or sort of, every applicant is in the top 5%. Which is fabulous and wonderful, because letter writers want to be really strong, but we recognize some of those challenges and biases as well that come through at times when we're reviewing things.
I think everyone has said such wonderful things, and I fully agree with them. And I think they're very consistent with our training program. I always just like to emphasize as well, whether it's when you're preparing your application or when we're reviewing the application, that we're thinking a lot about what we offer and how it can be in service to you and your professional goals. But we also really do emphasize and want to think about what you could bring to our program or to our our department even more broadly. And so unique experiences that you've had, whether they be life experiences, professional experiences, those are really nice to highlight because and again, that's a great like essay one space. It could come up in the diversity essay, it can come up in lots of different places, but what do you bring to our setting that could really enhance and make our training program better too? Things of that nature to highlight, I think, can be really nice because, and again, it's like weighing that with some of the comments made as well about humility. But everyone, people are interesting and people have such a diverse experience in their lives. And, a lot of times, and this might come up in our future panel as well, but we're not just thinking about internship, and we're primarily, when we're reviewing your application, we're thinking about internship, but they're also, we're a really robust program that has different levels of training. And so we're also thinking like potentially in the long term too, would this be somebody that would fit really nicely into our department long term or bring something unique? We're not making those decisions at this point in the process, but just as much as I know as applicants, you're thinking about postdoc opportunities or opportunities for other future endeavors, those are certainly on our mind as well. So again, not a deciding factor, but really nice to hear about you as people. Like whoever said bringing the humanity to the application, I think that's a really nice way of framing it. So we have just about 15 minutes left. What I think we can do, and thanks, people may not see Doctors Michelle Levine and Tina Goldstein from Pittsburgh here with us, but they've been very actively responding to your questions in the Q&A. But we also have an opportunity to just kind of open up the Q&A for the panel now. So if anyone has any questions that we haven't answered, that you'd like us to answer as a panel, we'd welcome you to put your questions in the Q&A, and I can just monitor those. It's, let's see, this one. The importance of writing cover letters to convey fit with and excitement for a site has been touched on a lot. Could you all speak to how to achieve this for sites that might have a very structured cover letter template? And then a specific question about Brown in particular, which I can answer as we discuss things moving forward. Anyone like to chime in with that?
We don't really have a structured cover letter, so I probably don't have much to add.
Likewise, we don't have a structured cover letter.
Us either.
Yep. I just say use it as a highlighter for your CV. That's kind of how I would recommend.
Yeah, I would just recommend following the structure and still trying to use it to highlight important pieces about yourself that you would kind of want to sell, and things about your experiences that fit with those of the program to which you're applying.
Yeah, we don't have a structure, but it's highlighting what you bring to the program, and I think that most importantly, what we offer to you that you're most excited about, but no heavy structure.
Great. Yeah. So I'll speak to our cover letter at Brown. So it's a bit of a template, but it's still pretty open-ended. We just ask that specific questions be answered in the cover letter. And I think of it as really a little bit of a cheat sheet to achieve the goals of what we've been talking about with respect to a strong cover letter. So we're asking applicants to our program to specify which rotations on the track to which they're applying would be of interest to them. And that's a great opportunity to share with us why. And that's really an opportunity to highlight the fit and to kind of connect the dots for the person reading your application to understand why you're applying to Brown and what opportunities are uniquely of interest to you, and how that fits into your larger story in terms of your professional training. We also ask our applicants to identify a potential mentor for a research placement. We do offer protected research time as part of our internship. And we, again, provide that as an opportunity for you to share with us where you think you fit in to the training that we offer. It also helps us narrow down as well for people who are offered an interview. We try to personalize the interview schedule for every applicant who interviews here. And so if we know who you're most interested in working with for your clinical placements and for your research placement, we try to make sure you're meeting with those people on your interview day. So some of it is, again, giving you an opportunity to express the fit. But some of it is also very useful to us in terms of just simply pairing you with interviewers on the interview day if you were to interview with us. So any other thoughts about the cover letter?
That's a really nice cheat sheet, I'll just say.
Agreed.
As someone who doesn't have structured questions, I would kind of like those questions to be reflected. So
yeah, so quickly scrolling through the questions here. We have so many, and we have lots of answers being typed as well. How about this one? Are there suggestions for what we should share with recommenders in addition to our goals and the programs we're applying to better have, oh, I lost the question. Sorry about that. Things are scrolling. Maybe it was answered. I'm sorry.
It's in the answered column. Are there suggestions for what we should share with recommenders in addition to our goals and the programs we are applying to better have it support our applications, since some schools add quite a bit of weight to it?
Thanks, Tara.
Sure.
I mean, ideally, your recommenders should know you well enough to know sort of what to highlight. If there's something you feel like in particular made your relationship with this person stand out, I would say, here are my goals for internship, and I really appreciated the time that we did X, Y, and Z together, or something like that. Maybe just to spark that. But ideally, you would not have to do that because your recommender would know you so well that they would already be speaking to it.
There's also a question about, excuse me, that who should be writing the letters of recommendation. So should we be selecting our letter writers mostly based on how well they know our clinical experiences or skills, or those who we've worked with most closely with written research? What would be most helpful, a mix of both?
I like a mix of both. I think I will say that if your dissertation chair is not on there, there should be a reason. Like that one, I'm always looking for that particular person because theoretically that's your mentor. And if for some reason that person's not on there, it's going to raise an eyebrow. Now, I have a student right now that I'm under dissertation committee, and her chair left and another chair took her place, and the new chair doesn't know her as well as her old chair. And so they're writing a joint letter. Absolutely. That's absolutely fine and, important to do. I would say one from a research mentor, one from maybe a practicum, somebody who knows you well. And then the third, I think it really depends on who you have a better relationship with. And also, if you want to go into research, it may make some sense to get another researcher. If you want to do more clinical work or like half and half, it may make sense to do somebody else. I think I would say one of each, and then the third can be whomever, but maybe somebody who knows you really well. I don't think it matters.
Yeah, I agree with that. I like to see a balance, and I do like to see one from your primary mentor, because that person has had a longer relationship with you. For me, for our program, we do look at sort of the duration. So three is a minimum number of letters. If you really, really want your current supervisor who's only known you for a few months to write a letter, then that might be better served as being the fourth letter. But I think that for us, we like to look at how long has this letter writer known you?
I would agree with all of that. I would also add, I sometimes hear from prospective interns the question of, should I have it be somebody who has maybe kind of a big name in the field versus maybe somebody who I've worked with more? I think it's the answer for us, at least, is the person who knows you best and can write you the best letter. I would be far more excited about a letter from somebody who knows you well and can really speak to the work that you've done together than maybe a nice but much less kind of a substantial letter from somebody who maybe has a name that everybody knows.
Absolutely. I will just agree
Could
on
not agree more. Yep. Yep.
Yeah. Something that has not been touched on that I have just been kind of increasingly aware that this can happen is when there are problems in the relationship between the applicant and their major advisor that may have more to do with the advisor than it does the applicant. So we don't want to penalize people for the absence of a letter. And it may make sense to talk with one of your other reference letter writers and have them speak to that, just to kind of explain, because it's there's not really a lot of opportunities within the application itself for applicants to do that. So just to kind of address any concerns about the absence of a letter of a major advisor, it can be helpful to talk to somebody else and they can kind of explain it.
I strongly agree with that. This actually happened to one of my students several years ago. She, just happened to get she asked a person who was not a great letter writer, and he wrote her a lukewarm letter, and she was not a lukewarm student. And she happened to apply to my site, and I saw this letter and I was like, oh my gosh, this is going to tank her. Like, this is terrible. Mm-hmm. And I literally reached out to her training director as well as other people that she applied to and said, this reflects the letter writer, not the student. Because it was just, so yes, if you're having a conflict, if other people know about it, your professional community can sort of intervene for you. And that's not out of line to ask them to do that. Like, we fight for our students.
Yes. That's such a important point to make, I think, and to say it out loud too. So thank you for that. So we have just a few minutes left, and we did, we realized as we were preparing for this that trying to cover all aspects of the internship process would be too much in one panel. And we do have our follow-up panel that will happen sometime in hopefully 2025, most likely after match day, the interview and match process. But just with the few remaining minutes we have left, do we have any general thoughts from our panelists about advice you have for preparing for interviews? I know we can't get into all the nitty-gritty details of interviews, but just general pieces that we could end with so we can preview a little bit of that for next time.
I will say that the one interview question you will probably always be asked is, tell me about your dissertation. Be able to explain it like you would to your grandma. That's it. You're going to be the expert on this, not the person you're talking to. So be able to explain it in a clear and concise way, because you know that everyone's going to ask you that.
Yeah. Also the why us question. And I think it's right. And I actually will say, again, it's anxiety provoking. That's normal. We know that there's going to be anxiety here, but it is helpful to practice perhaps those kind of high frequency questions. The why us, tell us about your dissertation. Aside from that, also, I would encourage people to be themselves, right? Mm-hmm. This is, again, it's about fit, and we really value you as humans. And I know that my colleagues do too. And this is another way that we want to not just showcase who we are and what we value, but we want to know that those values are aligned. So it's okay to be yourself in an interview too, but practice the high volume ones, because you're just going to get them over and over again.
Yeah, absolutely. We look for personable people, because I think, and we're also thinking, we have a very unique population. We want to know that you can come across comfortably, I think, is one of the things we're looking for. So just be yourself, be authentic. But the other thing too is maybe just do your research in terms of knowing what the program is about, so that you can better answer the why us.
The thing that I would also add is, I know something we talk about a lot is that empirically, we're a clinical science program over here, as many of you are, interviews actually don't predict a whole lot. They are not predictive of success. And so often what we think about with interviews, are there red flags? Can you convey and communicate well? To Shirley's point, sort of, is there a level of comfort? We do it. We know it's anxiety provoking. It is, we know that you're not necessarily coming across as your most comfortable, best sort of space right there in that point in time. But in many ways, it's about sort of can you think critically? Can you think conceptually? Talking about the integrated report as you explain your dissertation. If I ask you a question about, and what does that mean for the future? What are your next questions? What are your next steps? Are you able to think about that thoughtfully and explain that in a way that, again, your grandma could understand? I'm not a neuroscientist, but if you come at me with that and can explain it to me, I think that's really helpful. And also, I just want to re-emphasize what many people have said, is that to be authentic, and to really be yourself and who you are as you come across, as you interview.
I think that's such a lovely note to end on, right at 2 p.m. Eastern time. Be yourself. You know, I really appreciate that we've been able to hopefully bring some of the humanity into the process of the internship application. And we really do appreciate all of your great questions and interest in the topic. And again, want to express our thanks to APCS for the funding that enabled us to be able to pull this panel together and do the formative work to help us structure the focus for today. We will be archiving the video, and more information will be sent out soon about how you can access the video moving forward. And as we've mentioned as well, we will also have a follow-up panel to address additional questions related to interviews and matching and anything that we didn't quite have time to do in our first panel today. I also want to thank all of our panelists, as well as our organizing committee, and particularly our student committee members, Riley Juppy and Lucia Mera, who really kept the boat moving. I mix my metaphors all the time. So whatever the right metaphor is, they kept us rowing in the right direction. So thank you to everyone. And thanks again for your time and attention. And we'll look forward to seeing you next time.